Thank you very much. Good morning. As was said, I'm the lead at the Local Government Association for Public Health. I'm also a local councillor in Hackney, Hackney in East London has some of the most obese children in the country, so it's a key priority for us locally. And I'm also a father of a 6-month-old and a 2.5-year-old, and I think portion size, well-informed people, and I'm sure that applies to many of the people in this room too, find it very difficult around issues like portion size. So I think sometimes we like to suggest that this is somehow a problem for disaffected parents or vulnerable parents, and actually I think this is a challenge for all of us. And I was going to frame childhood obesity in terms of it being probably the biggest threat to the future well-being of our children, but as has already been mentioned, I think what's happened in America overnight may be a slightly bigger threat to the future well-being of our children. But let's control the things we can control. So what I wanted to cover was to say a little bit more about the National Obesity Plan, to give some insight into the areas that councils are responsible for, because our role in public health is a relatively new one. To talk a bit about what we've been doing in Hackney to tackle what, as I've already said, is a really big problem, to talk about some other examples of what's happening locally in other parts of the country, and then to talk about where we go next. So in terms of the government's obesity plan, obviously it was originally meant to be a much more ambitious strategy, and it was clearly watered down. And I think there's a strong sense that it was watered down when Theresa May became Prime Minister and looked at her inbox and wanted to set perhaps a different tone to her predecessor. And I think it's disappointing that she would have chosen this area of policy to kind of set that different direction. There are things that it's pretty clear there was going to be more of a focus on in the original plan, in particular the marketing of junk food to children that were taken out. And I think that was in a bid to seem like the government wasn't going to be as nanny state and wasn't going to be as interfering in terms of how business operates. But I think that was a real missed opportunity. But we, in local government, we agree with the sentiments and the ambitions behind the plan, but we're disappointed that the plan doesn't really follow through in terms of actions. What is very positive is probably for the first time a recognition from central government that obesity is a really complex problem, and therefore we need a whole system response if we're going to make a really big difference. And very disappointingly, there was limited mention of local councils. And I'll come on to this in a moment. And it's not just that we have lots of legal responsibilities in this area, but if you want a whole system approach to tackling obesity, local authorities have a responsibility and have levers in almost every one of those areas. So we think it was, again, a missed opportunity that we weren't more prominent. The stats that we've already heard some of them, and the stats that were outlined in the plan show the scale of the problem. None of this is going to surprise you, but I think perhaps the most important is the final point, which is that children from the poorest income groups are twice as likely to be obese as those from the most well-off groups in society. So childhood obesity is a social justice issue. And that's certainly something that drives our work in Hackney and drives the high level of investment that we put into this, because it's just not fair that children from some parts of the community are going to have their current and future health threatened when we know that there are things that we can do to deal with that. As has already been described, we know that obesity isn't just bad for children as they're growing up, that it stores up problems for them in later life, and therefore it makes financial and economic sense for the public sector to invest really heavily as early as possible. And when I talk about what we're doing in Hackney and what's happening in other parts of the country, you'll see that particularly in a time of reduced resources, councils are really focusing on how we can get in there incredibly early, either when children are very young or during pregnancy. The 14 key areas of action in the plan, it probably helps to look at it in that way. It makes it easier to understand what's in the plan and what isn't. 7 relate to food, 4 relate to work with schools. There's 1 around new technology, and as already been described, there's 2 that are particularly relevant to today. So supporting early years settings and enabling health professionals to better support families. And we know that early years is crucial to child development, and we know that health visitors and school nurses in particular have a really big role to play here, and we need to think about how we can best provide them with the confidence and the skills they need in order to work with parents and children to make a real difference as early as possible. it wouldn't be right to talk about this and to talk about local authorities' role if I didn't talk about the situation with public health funding. So councils have taken on lots of new responsibilities and now face significant funding reductions in terms of their public health budgets. And that's alongside really massive reductions in our core budgets. So all the areas that could help in this challenge, whether that's having good parks, having reliable, attractive play equipment, being able to promote things like cycling and walking and other forms of sustainable transport. All of that is under real strain because of our funding situation, but the changes to public health funding have been particularly disappointing. So, as has already been said, we always talk about prevention, but when push comes to shove, if there's a small amount of money to be put into health, then it's always put into hospitals, frankly. It's put into bailing out the hospital sector rather than investing in prevention. We also did an in-year cut announced in November 2015, and that's a really difficult thing to deal with when you've set budgets and you've commissioned projects and then the money is taken away from you in the middle of the year. And really importantly, the ring fence on the public health budget is being maintained but will end in 2017-18. And linked to that, local governments' public health resources are going to come out of what's called retained business rates. So at the moment, if you're a business, the council invoices you for business rates, but it all goes to central government and then it's redistributed around the country. The government feels that doesn't provide enough incentive for councils to drive economic growth. So we are going to become increasingly reliant on the business rates that we generate locally. And that will potentially be good news for Westminster, for Kensington and Chelsea, where we are today, even for a place like Hackney, which traditionally has been poor but has a lot of growth. But if you're in some towns in the north of England where the economy really hasn't been motoring for a very long time, no matter how hard you try, you may not get that growth. And if not getting that growth means that the funding you have available for investing in public health is reduced, then that certainly seems to us in local government as completely counterproductive. And you could have a sort of downward spiral in terms of areas with some of the poorest public health outcomes having the least additional resource to deal with that. And the second point about the ring fence coming off public health is that whilst in local government we feel that we want as little restriction as possible on how we use our scarce resources, I'd be lying to you if I didn't say that if you remove that ring fence, there's going to be an awful lot of calls on that resource. And it is possible that in certain parts of the country, money that is currently being spent on prevention and on public health prevention will be diverted to other what are seen as equally important but perhaps more politically prioritised areas. And one of the ways that the government wants to deal with the potential challenge there is that there are some services that are provided in relation to public health that are mandated, so they're a legal requirement. But in relation to obesity, the only real legal requirement is that we continue to measure children. And measuring children is important, it gives us really useful data. But if we're measuring children and we don't have the money to do anything about the results that we get, then I think that's going to put us in a very tricky situation in the medium term. So as I said, local councils have a series of responsibilities relevant in this area. So the transfer of public health responsibilities happened in 2013, and councils, I think, have really embraced this challenge. I think for us, when we see poor public health outcomes and we see health inequalities, as a local councillor like me, that isn't where we are in a league table, it's not a graph, it's the lived experience of the people that we are privileged enough to represent. So we see these problems on a daily basis in the communities that we represent, and therefore we really want to do something about it. We have legal requirements around tackling health inequalities, but I think there's a moral imperative around reducing health inequalities, and that's certainly what drives the work that we do in Hackney. And then from October 2015, additional public health responsibilities around the public health of children aged 0 to 5 transferred to local authorities, and again that's created some really interesting opportunities about how we can start to tackle some of these issues at the very earliest stage. And I said earlier that there's a real challenge in terms of the impact of austerity on council budgets, because if you look at the I don't know if you see this well enough, but this is basically outlining all the things that can drive childhood obesity, and there's almost nothing there that isn't something that local councils can influence, whether that is the obesogenic environment, whether it's promoting cycling and walking, whether it's education, whether it's physical activity. There are all those areas that councils can influence, and the key, I think, is having leadership at a very high level within a local authority to say, whenever we're making decisions, whether that's about planning or regeneration or about schools, we're always thinking health, we're always thinking public health, and in particular we're thinking what positive impact could this have on the levels of childhood obesity in our area. So in terms of Hackney, if you're not familiar with it, it is a very small, geographically, but a growing borough. It has a relatively young population. It has a greater proportion of people under 40 than the national average. It's a very diverse community, and it has some particular communities that you don't get in other parts of the country. So in particular, we have a very large and growing Orthodox Jewish community, and it's really it's the biggest of its type in the country, and it presents some challenges that I will come to in a moment. It is very deprived. Until very recently, it was the second most deprived borough in the country, but as East London gentrifies and as Hackney becomes a cooler place and the transport improves, some of that is changing. But one of our challenges is, as that changes, as that gentrification happens, and as wealthier people move in, does that hide some of the health inequalities? So how do we make sure that we know that we're not just succeeding because rich people have moved in and poorer people have moved out? How do we ensure that we know that we are helping the people who are struggling at the moment? So we obviously have had the latest child measurement data come in last week, which showed that it's relatively stable, but there was a slight rise in Hackney, both for reception and year 6. And I don't think we're alone in, there isn't really a council in the country that is seeing a sort of significant decline in childhood obesity rates. And I think part of that is no one really knows what works. And I think if someone was to say to me or another councillor in my position, there is this initiative, and if you do it and you do it well, it will reduce childhood obesity consistently and fairly dramatically. Even if it was expensive, I think we would find the resources to do it. But one of the challenges is no one really knows exactly what works, and that makes it very difficult to justify resources. And I think what will often happen, and it's happened in relation to the childhood obesity plan, is whilst recognising it's a complex problem, whenever you suggest a solution, whether it's the sugar tax or something else, people will say, well, that alone isn't going to solve the problem, therefore you shouldn't do it. And I think that's maybe one of the reasons that industry has managed to lobby to have the childhood obesity plan watered down. And it's true that none of those individual things are going to make a difference, but what we've been trying to do in Hackney is trying a whole range of things, because we think in combination they can make a difference, but also ensuring that we evaluate all of that work so that we can identify what has the most impact, so that we can continue to invest in that. And there's also an issue here which may come up in the question and answer session, which is BMI a measure that works for all groups? Because there is a sense that for some groups BMI doesn't work. So for some non-white ethnic groups is maybe not an entirely reliable indicator of health problems relating to weight, and that's a particular challenge for inner London boroughs, and I think we need some additional work done in that area. So as I said, Hackney is a place that is changing fast. It's gentrifying, property prices are going up, but there is a rise in health inequalities. And as I mentioned a moment ago, how do we ensure that when we see positive change, it's not just about gentrification and we're actually making positive changes in individual people's lives? And I think the way that we want to address that is by targeting services to communities that are most in need. So I think you'll see two trends in public health interventions across the country as money gets tighter. One is proportionate universalism, if you like, so targeting services, a universal offer, but really targeting resources on people most in need, but also investing early where possible. As I said, the financial challenge is really significant, and it means that we're having to think much more creatively about how we deliver services. And I think most councils inherited from primary care trusts a set of public health interventions that we have now reviewed and recommissioned and redesigned. And I think in some areas that means that we're doing more with less. But the overall reality is that funding is going to be incredibly difficult, and we're not going to be able to do all the things that we want, so we do need to prioritise. I mentioned earlier that there's all sorts of areas other than sort of direct childhood obesity interventions that can help families to make healthier choices. So how do we influence the wider obesogenic environment? So this is a heat map of hot food takeaways in Hackney. We have huge numbers. And we have responded to that by having a new planning policy that says that you can't open a new hot food takeaway within 400 metres of a secondary school. We initially looked at doing it 400 metres around a primary school, but we have so many primary schools and we're so small that that would have effectively meant you can't open a hot food takeaway anywhere other than the middle of Hackney Marshes. And it's not that we thought that was a bad idea, we were advised that that would probably not resist legal challenge. And there is a sense that, which I don't think is entirely true when you get to the later stages in primary school, but there is a sense that hot food takeaways are generally used by children who are 11 and above when they're shopping on their own. The trouble with that is all the councils that have looked at doing a fast food planning policy are only doing it because they're already saturated with fast food restaurants. And in some ways, it's the areas that don't have this problem yet who should be putting this policy in place. And it's very difficult to know what else you can do, because if someone has invested in a hot food takeaway business, you can't go along to them several years later and say, we're going to take away your livelihood because we don't think that what you're providing is healthy for local people. So you can't do it retrospectively. So what we're also trying to do with the fast food restaurants that already exist is working with them about how can they make some small practical changes that make their offer slightly healthier. So in terms of our local response, as I said, it's really important to have leadership and buy-in from the very top levels of the council. So we have an obesity group that is led by our chief executive. The Health and Wellbeing Board, which I chair, has obesity as one of its 4 priorities. So that means that we're getting the input not just of the council, but of the CCG, of the local GP federation, of the local hospital, even the mental health trust, and the voluntary sector. So everyone is coming together around 4 priorities, and childhood obesity is one of those. And it's really powerful when people come from all those different parts of the health system and focus on a key goal like obesity. In terms of achievements to date, one of the things we're really proud of is Place Streets, which is something that started in Bristol, and then a Bristol resident came to Hackney and said, why can't we do this? So you close off a residential road once a week, once a month, and marshals ensure that cars can come in and out safely, and it means that children can play in the street like they probably did many years ago, and for a whole host of reasons stopped doing. And what we found with that is that not only is it good in terms of children's physical activity, but we're in a borough that's changing very quickly. It's also very positive in terms of social cohesion. So people are talking to each other, which obviously doesn't happen all the time in London with their neighbours. People are talking to each other, often about their children, but that's prompting other conversations and prompting other links and networks. So we think that's incredibly positive. We have been working with our children's centres and other early years settings to give advice on what a healthy food and drink policy would look like, and that's had really good take-up. We've offered regular annual £5,000 healthy lifestyles grants to our children's centres. So, councils don't know the best way to do things. We're good at lots of things, but innovation tends not to be one of them. So if we give people an annual grant of £5,000, not a huge amount of money, but not insignificant, and say, can you come up with some ideas around what you could do with that in order to promote healthier lifestyles and to reduce the impact of childhood obesity, then that's a great idea. And it means that if we see things that are working really well, then we can try and scale those up. We've also adopted a policy called Health Heroes. So Health Heroes is the practical implementation of what I described earlier, which is effectively throwing a series of initiatives at a problem to see what sticks. So there were a few schools that either had a particularly significant childhood obesity challenge, or schools that were very reflective of the demographics of the borough. So we wanted schools that were kind of representative of the challenges the borough faces. And a whole series of interventions, from reviewing the catering setup to having cook and eat classes that involve parents, gardening clubs, lots of stuff around increased physical activity, and evaluating that to try and see what worked best, so that we can then roll out perhaps a more modest programme given our resources, but a programme that focuses on the areas that work best. As I said, there are some new opportunities, particularly around the transfer of 0 to 5 public health services, and we want to make the most of those. And we want to make sure that whatever we're doing, we're building evaluation in at the very beginning, because I think there's a responsibility on all local authorities when they're investing in these areas to evaluate, so that we can share best practice with other areas, because no one knows what works best yet. And therefore, as soon as we hit upon something that seems to be having a really big impact, given the scale and the urgency of the childhood obesity challenge, we think it's really important and that work is shared as soon as possible. So I just wanted to briefly touch upon some work that's happening in some other areas. So in Telford and Wrekin, there is a real focus on working with pregnant mums, so midwives making referrals if women have a BMI over 30 at their first assessment, and then dedicated support is offered until the child is 6 months of age. And 2/3 of the women who have been involved in this project have restricted their weight gain to 10 kilograms, which is the aim of the project. So some really interesting work happening there and some really positive results. In Medway, they've set up a local obesity network, and they've been very clear that they feel that it's a complex problem with lots of people who can make a contribution. And unlike probably most areas of the country, they've positively embraced the idea of partnership work with the private sector, and they've been working particularly closely with Tesco in their area, again with some interesting results. In Lambeth, there's been a focus on training up frontline staff. So the whole point that was mentioned earlier about making every contact count, it's hard to make every contact count if people don't feel they have the skills and the confidence to deal with an issue. So it's one thing to identify a child who might have issues in terms of their nutritional intake, who may be overweight, but what do you then do about it? And how do you train as many people as possible who come across these children and their families to provide advice in a way that is going to be received well? So how you deal with fussy eaters, for example, is something that from Lambeth came up as an area where frontline workers felt they didn't necessarily have the confidence to deal with the issue, and with some relatively simple training you can make a really big difference there. And in Cornwall, this is a specific scheme for under fives, which is offering some support to early years providers, so everything from individual childminders through to children's centres and nurseries, and they're getting some really good coverage, which is particularly challenging in a geographically big borough, big council area like Cornwall, and now 40% of early years providers are on board. So in order to access the advice and support, you have to commit to some fairly realistic targets around healthy eating and nutrition. So again, everywhere we're seeing a focus on those who are most vulnerable, but also real focus on early years. And I think we're seeing that actually across public health. And it's not in any way giving up on people who have health challenges who are in their 30s and 40s, but it's a recognition that in terms of return on investment, it's much more productive to invest as early as possible. So there's another range of initiatives here in other parts of the country, which we have links to on the Local Government Association website. In terms of work in progress and next steps, we're looking at the consultation on the sugar tax. I've always been reassured by people I speak to in central government that the sugar tax is definitely going to happen, but I think no one really knows anything in politics anymore. And the soft drinks industry, as it did in America when trying to fight soda taxes in individual states, is mounting a populist crusade that this is a government interfering in your life, this is a government telling you how to bring up your children, this is the government trying to take away one of the small pleasures you might have, and this is something that's going to hit the pockets of people who are already struggling. So I don't think it's, must never assume that any of these things are a done deal. And also the specifics of how the soft drinks industry levy is implemented will have a big impact. So we've got to be really wary of the government rowing back on this commitment, given how watered down the obesity plan is already. So some of the things that the Local Government Association has been calling for some years and would like to see happen soon is a mandatory reduction of sugar in soft drinks rather than using the levy on its own. Much better sugar labelling on food and drinks products. So how do you make it easy for individuals and their families to make healthy decisions? We'd like to see calorie counts on menus in all chain restaurants, and some restaurants are doing this already. So McDonald's and KFC, for example, do this. But how do you make that more routine, and how do you do it in a way that is easily understandable? We'd like councils to be given the powers to ban junk food advertising near schools. And I'm struck by at first you think it's coincidence, but then you realise over time that it's a deliberate strategy of advertising, particularly fast food chains, on bus shelter ads, for example, very near schools. So how do you give us the powers to stop that? And just broader powers around planning. How do as a local area, I think local people should have as much power as they want in terms of shaping their neighbourhood, particularly shaping it in a way that makes it healthier. So how do we get that? And we also would like to see the sugar tax levy, if it does go ahead, to be administered by councils. So the plan at the moment is that money would go direct to schools. And we feel that it would be, given that it will be relatively modest amounts of money, given the pressure on public health budgets more generally, we think pulling that all together, aggregating it at council level, means that we can spend it more wisely, and in particular we can target it at the areas that need it most. So if it goes to every school, then it means that in areas of the country where there isn't really an obesity challenge and where the children don't really face many public health challenges at all, they will be getting similar money to areas like mine where the challenge is really severe. So we think that at least if it was given to councils, we could direct the resources within our own area to the places that need it most. This presentation will be available electronically, and if you go to the LGA website, we have some really useful resources around the role of local government, the role of providers, and what you can do, what are the practical steps you can take to make a real big difference in this area. And that's me. So thank you very much.